Hi, this is Christy Mayo, and I am doing a presentation on health concerns for Nursing 4400. And my topic is super obese greater than 50 BMI. Obesity can affect any race, ethnicity, gender, age, or economic status. Obesity is separated into different classifications by BMI or body mass index. Obesity is a problem throughout the population. However, among adults, the prevalence is highest in the middle-aged people and for non-Hispanic, Black, and Mexican American women. Most standard charts have just 3 classifications of obesity, but others have added a 4th for super obesity. The super obese are defined as those having a BMI greater than 50. To give you an idea about how much a person would weigh, if you were an average height of 5'7", you would have to weigh around 320 pounds for your BMI to be 50. In the US, we have had a sharp increase in obesity in recent decades with the way Americans have changed how we eat and live. This graph shows the trends in age-adjusted obesity and severe obesity prevalences among adults aged 20 and over in the United States from 1999 to 2018. According to the Public Health Indicator-Based Information System, or IBIS, locally, Sanpete County has 26.7% of their population that are obese with a BMI greater than or equal to 30, while the state of Utah has 28.4%. The CDC reports that in 2017, 42.4% of the nation is obese, and 9.2% are severely obese. The World Health Organization, or the WHO, reports about 13% of the world's adult population were obese in 2016. Some of the social determinants of health for the super obese are food costs and access to healthy foods. Many of this vulnerable population may not have access to healthy foods due to cost or availability, but this is more so for the super obese. Many people in this population are bed or homebound and unable to obtain food for themselves and must rely on someone else to provide their food. Culture. Our American culture, we eat to celebrate, we eat to socialize, we eat to reward ourselves, and we eat when we are emotional. Mobility. The super obese may be limited to accessing food, employment, and healthcare due to their limited mobility. Many of this population struggle to just leave their homes. Their transportation options may be limited as well due to the physical size of their body weight. It may be uncomfortable or impossible to fit in some forms of transportation. Access to health care. They may have limited access due to transportation. The super obese population may not be able to obtain the health care that they need. And health literacy. They may have a difficult time obtaining this information due to not being able to get to healthcare accesses. Access to healthcare is difficult and may require special transportation, equipment, and diagnostic devices that can accommodate the patient population. Super obese patients may feel like the healthcare system is not prepared to meet their needs. Jones and Padilla suggest that the morbidly obese will often not enter the healthcare system until there is an absolute need due to their experience in entering a system that is ill-prepared for their specific needs. The Office of the Surgeon General suggests that changes in our behaviors and environment have made people prone to obesity. Our lifestyle changes in society have changed. We're constantly glued to technology like the television, computers, and our phones, which promotes a sedentary lifestyle. The super obese population have difficulty moving and lack the ability to get enough physical activity to help them lose weight and become healthy. Diet also has become an epidemic in our nation. In recent decades, high-calorie fast foods have become more frequently eaten because of the American lifestyle. Portion sizes have increased, and we drink more sugary drinks. For this specific population, this has been an increased problem to obtain healthy, affordable options that will meet caloric needs. For the super obese, Maslow's first level is often met: air, water, food, and sleep. But some may still struggle with just these basic needs due to their size and their limited mobility. Most of the super obese population will not have met the rest of the levels on Maslow's hierarchy of needs, and their functional level will be mostly focused on meeting their physiological needs. Their health will suffer physically, mentally, emotionally, and financially. Skin infections are an important consideration in the super obese population. With skin breakdown occurring often, the chance to acquire infections like MRSA and staph are increased. Due to the size, this population also may have breathing issues, making them more susceptible to communicable diseases like pneumonia or influenza. The super obese populations are at risk of many non-communicable diseases and infections, such as type 2 diabetes, cardiovascular disease, stroke, kidney disease, cancer, candidias, pressure ulcers. Death in this population usually happens from a chronic health condition due to their obesity early in life. Specific concerns for this health population with self-care and self-harm are that their mobility and transportation are concerns for self-care. Many in this population are not mobile and may not even be able to walk or have access to transportation that they will fit in, making it difficult to obtain medications and health care. They also may be at risk for self-harm due to decreased mood stability, low self-esteem, and lack of social interaction. Many people in this population are unable to provide basic cares for themselves. They may rely heavily on others to help them bathe, use the restroom for food and mobility. This may put them at risk for emotional and psychological abuse or neglect from others. Even those that try to make improvements to improve their health may feel shamed when they are out in public and people stare and point at them. And this last slide is just my references. Thanks for listening.